everyone. Thank you for the nice introduction. Sorry for not being there with you. So I will share my presentation. Okay. No. Okay, so as introduced, I will talk you about the microbiota-gut-brain axis in neurodevelopmental disorders. So these are my disclosures. So the human microbiota refers to the microorganisms we can find on every part of the body. We do know that the microbiota is site-specific. So for example, the microbiota that we find on the skin is different from the microbiota on the vagina because different bacteria are there. Do also know that the most known microbiota is the gut microbiota. And this is why this is the most represented. And there are four main features, which are the protobacteria, the actinobacteria, the firmicutes, and the bacteroides. For the firmicutes and the bacteroides, which you may have been aware of this, are about the 19% of the bacteria in the gut. When all these bacteria are like, well, the one with each other, condition is called eubiosis. They are producing locally some substances which are beneficial for the host. But when some of these bacteria are beginning to fight with the others, there is a condition which is called dysbiosis. In this occasion, so the bacteria are producing some like pro-inflammatory cytokines, which make like local inflammation in the gut. But also the gut is becoming leaky, so it allows these substances to reach the blood flow and to go everywhere in our body. So this is the reason for like we can have some inflammatory conditions, some cardiovascular disorders, but we do now know that it is the reason why we can also have neurological disorders. So the story of the microbiota starts from pregnancy. We do know that in mother there are hormonal changes and also immune profile changes that allows the mother to carry the fetus. But these like changes also are seen in the microdiversity. And during pregnancy, this reduction of the microbial diversity in the mom. We do also know that a lot of conditions which may happen during pregnancy may change locally the microbiota. One important thing in the life of the baby is the mode of delivery. We do know that the bacteria in the skin are completely different than the bacteria in the vagina. So the cesarean, it's different from vaginal birth because the fetus, which is becoming a baby, comes into touch with completely different bacterial species, which will provide the core of his future microbiota. But we do also know that at the human gut is mainly composed by an aerobic population. There is oxygen locally, so the bacterial species are making using oxygen to live, and these are Enterobacteriaceae. But after few days, they are completely depleting the oxygen levels, so the bacteria turns to anaerobic species, which are more that of the adult gut microbiota. We do know that the critical window for the position of the microbiota when it's more plastic and external factors can influence its composition are the first 3 years of age. But we do also know that these windows is like particularly important for the neurodevelopment. So this is a period when the dendritic harboring and synapse formation is still going on in the baby. And this is very important so we can understand how altered microbiota can influence the formation of the central nervous system, giving the predisposition to the development later in life of autism spectrum disorders, for which the evidences of the link with the gut microbiota are very, very strong, or also ADHD, but also later in life depression or anxiety disorder. But maybe you are asking yourself how these things can reach the central nervous system. We do know that blood-brain barrier, which contains like a sanctuary in the central nervous system, not allowing some substances to get in. But we do know, and this is from 2016, so it's only 10 years, we know that there are some specific transporters in the brain blood barrier, which are monocarboxylic transporters, which can carry some substances which are produced locally by the bacteria, which are short-chain fatty acids like butyrate. They can reach the systemic blood flow, and then through these transporters, they could get the central nervous system, allowing the effect on the central nervous system formation and constitution. But when we speak about microbiomes, there are terms which we can keep in mind. And these are the fact that the bacteria are an animal kingdom. So we can refer to them through phylum, which is the less specific, for example, Firmicutes, and going deeper into the definition until the species. So, for example, the Lactobacillus helveticus. There are also other two concepts that are really important when we speak about the gut microbiota, which are the alpha diversity, which are the different bacterial population that you can find inside the same cell, and instead the beta diversity, which differences in terms of bacterial population that you can find in different samples. But one main point, as you can see in this slide, where it's in Italian, but it's saying who comes first. So who comes first? The modifications in the gut microbiota, we can give a predisposition to the development of like new developmental disorders, as we have seen, or also, for example, some condition has seizures are causing systemic inflammation, and so determining further modification locally in the gut microbiota in a sort of circle which is influencing themselves. So here you can see the results of a clinical study we conducted in collaboration with Anna Maria Vezzani and Teresa Ravizza from the Mario Negri Institute in Milan. And so basically we choose this rat model. In this rat model, epilepsy caused by the injection of cyanuric acids into the amygdala. And this is like a model of temporal lobe epilepsy in the adult. But the interesting thing about this model is that the induction is caused by the injection into the amygdala and not into the peritoneus, such as in other models. And so this would allow us to study the gut microbiota without the interaction of the administration of the cyanuric acid. Furthermore, we do know that in this model of epilepsy, about 60% of the rats developed epilepsy after the injection of cyanuric acids, but about 40% of, despite the injection of the kainic acids into the amygdala are not developing epilepsy. So our question was, there is something protective in that which allows them not to develop epilepsy, to be like in a certain way protective of seizures. So in this case, we collected plasma samples from the blood of the animals, feces, also at the sacrifice section of the duodenum and the jejunum. So from the anatomical histopathological analysis, as you can see here, you can see section of duodenum and the jejunum. And what out in both the duodenum and jejunum was that the ratio between the height of the villus and the depth of the crypt was consistently different in the rats who were developing epilepsy compared to those who were not developing epilepsy and the controls. So meaning that there were like histological changes in the gut of those animals. Moreover, as you see, this is for the macrophage activation. So you can see a quantitative analysis of the macrophage with a specific like color. And the activation of the macrophage locally for the group of rats which develop epilepsy was statistically significant higher in this group as compared to the sham, so the control, and those who were not developing epilepsy. To the genomic analysis, so trying out what was there, so locally the bacterial species, the gut, from a point of view of the alpha diversity, so the different bacterial population in one sample between the different groups, we were not able to find differences, also using different methods for the analysis. But going to the beta diversity, which is the different composition of bacterial species in different samples, as you can see here, there was a clear clustering of the control group as compared to the other groups. So meaning that the bacterial population represented in each group were significantly different. But to really characterize what was there, as you can see here, the most interesting thing was that we found like a reduction of particular bacterial species, which are the Butyrococcus, in the group of rats who developed epilepsy as compared to those who were not developing epilepsy. Why is the Butyrococcus so interesting? Because it's part of the group of those bacteria which are producing short-chain fatty acids such as butyrate, acetate, propionate, which do know that have a beneficial effect on the central nervous system, and through that monocarboxylic transporter, they can reach the central nervous system. So there should be something in the bacterial species, rats, which are not developing, which can protect from the development of seizure. And this could be the Butyrococcus, so bacteria which are producing short-chain fatty acids, which are raising the systemic blood flow. But one important point when we speak about the gut microbiota is the translationability. So when we are thinking about rats or mice, they are in their cage, in the same environment, they eat the same thing, so the external confounding factors are the same. But when we humans, there are different things, size, our lifestyles are completely different. So the bacterial species are not the same from the mice and to the human. And also we have to take into account that there should be confounding variables. So what we have done in the clinic, and this is our study, conduct population of epileptic patients with a genetic basis, was to try to understand if there are differences between those patients who are like responded to the anti-seizure medications, and those patients who were not respondent to anti-seizure medication, so drug resistant and need add-on therapies to have a good control of seizures. So basically, we collect the feces of these patients, which is quite minimally invasive, and also we add some questionnaires to try to assess the confounding variable. And as you see here, we administered a semi-quantitative food frequency questionnaire, which is in Italian, but basically it asks how many times a week or in a month, in the last 3 months, you eat specific things to try to have a proportion of the main macronutrients. And then also another useful clinical tool that we use in the clinic, it's the braces surcharge. And as you can see represented, it assesses how is your poo. So basically type 1 and 2 are really hard feces. Type 3 and 4 are normal feces, while type 5, 6, and 7 are really soft feces, indicating. So this is really fast to administer to patients, and also the mothers are always on the line with this. They can tell you easily what the type of feces of the baby is. And this is like a useful tool to try to assess what is the gut state for that specific. It could be very helpful and easy also in everyday life. So CFACE is important. And from that study, what we found out and what was really interesting is that this particular bacteria, which is the Eubacterium, was really in term of abundance in the distant group versus the drug sensitive group. Of course, the name is different from the name that we saw in the rats, as the bacteria species are completely different in the mice versus the human, but also these bacteria are responsible for the production of short-chain fatty acids. So once again, we found out that a reduction of these bacterial species, which are producing beneficial substances such as butyrate, may be the drug resistance in epilepsy. We can act on the gut microbiota. So one first step is for sure the diet. So the ketogenic diet, which has been long known as a treatment for drug-resistant epilepsy, or variants of the ketogenic diet, but also probiotics, which are live microorganisms, which, if administered in adequate amount, can reach the gut. The probiotics, which are the substances that the bacteria are using to live, for example, soluble fibers, and the postbiotics, that are the products that the bacteria made when they use their substrates. And they are basically just substances that we have seen, so the short-chain fatty acids, butyrate, which can be found in the blood. But speaking about it, and in particular the ketogenic diet, where we can put the turning point, I think that the turning point is the work from Olson, which was published in Cell in 2018, where the author rated that the effect of the diet, which is known for being helpful in drug-resistant epilepsy, it's in through a modification locally of the gut microbiota, with an increase in abundance of Akkermansia and Parabacteroides. And this modification locally in the gut microbiota is what makes then a better response to the anti-seizure medication. So the ketogenic diet on response to seizure is indirect and is through the modification of the gut microbiota. And why this work is so important, why through other experiments, the authors also demonstrated that germ-free mice, where the gut microbiota is completely deleted through the use of antibiotics, do not have the same beneficial effect of the ketogenic diet on the control of seizure, because there is no the place where ketogenic diet can act. There are no bacteria, and so there is no better response to anti-seizure medication and better seizure control. I just wanted to show you some results. This is a sub-analysis of the work that we published in Epilepsia, but we did not publish because we did not reach this particular analysis, the statistical significance. In particular, we wanted to see if there were differences between contrast and epilepsy patients in gut microbiota locally, taking into account diet, so high fat, low carbohydrates versus low fat, high carbohydrates, which is like a mimic of the ketogenic diet, but less restrictive and more feasible in the everyday life. And what we found out was no differences in the beta diversity. As you can see here, there is minimal clustering in the beta diversity, but we were not able to reach the statistical significance because the sample was too small. But from a point of view of the analysis of the bacteria species which were there, at this level, we found a trend towards significance in the presence of the blasia, was more represented in the group which had a high fat, low carbohydrate, resembling the ketogenic diet. We do know from the literature that the Blausia has already been described in the literature, and it should be bacteria with a probiotic activity. So maybe increasing this group and this study would be really interesting to see the trend through statistical significance. But how we can really address the ketogenic diet and the gut microbiota? What are the key points that bring home with us about this? So the ketogenic diet or is varied. So in general, our lifestyle and the diet promotes changes in the gut community structure in terms of alpha beta diversity. Locally, the gut microbiota is able to produce substances which are really interesting, such as short chain fatty acids, which can reach the blood flow and which could be quantitatively measured in the blood, could be like biomarkers of response and disease progression. And we hope in the future to be able to address these biomarkers to understand if one patient will be responsive or not to anti-seizure medication. And so the key point is that it's not all important who is there, so the bacterial species which are in the gut, but I would say what produce and they release systemically. And so this would be the biomarker that we will be able to use in the very close future through this kind of studies. And I hope to have been in time, and thank you for listening.